Hi, welcome to PedChat. Today I had a chance to interview Dr. Igor Shumskiy, who's an acute care pediatrician at Boston Children's Medical Center. A pediatrician by trade, Igor is passionate about transforming the American healthcare system to meet the needs of low-income families. His grandmother Nella was a pediatrician in Ukraine, and she practiced medicine the old-fashioned way by going door to door and caring for families in their living rooms. This inspired Igor to go into medicine and become a now social impact entrepreneur with his company Nella, named after his grandmother. Nella is offering 24/7 on-demand access to expert medical triage for the underprivileged and resource-limited families in America. Igor has an incredible story and is so passionate about what he is doing. So sit back, relax, and become inspired.
I want to say welcome, Igor Shumskiy. How do you pronounce it?
Perfect. That's fantastic.
I got it? All right.
Yeah.
And you are a pediatrician and entrepreneur out of Boston, Massachusetts. Currently, you are sitting in the Harvard Innovation Labs Venture Incubation Program. There you go.
Say that 5 times fast.
No, thank you. I'll just end up editing it out. We talked about the story of your grandmother and how you saw her taking care of people. I think it was in Ukraine. I'd love to hear that story and how that inspired you to get into medicine and how that's led you to where you are now.
My grandmother finished medical school in 1950 in Ukraine, which was then the Soviet Union. She lived under Soviet control, and healthcare was very different then and in Ukraine. Growing up, I heard stories about how she worked very long hours. Essentially, she would spend 50% of her time in the hospital, and then 50% of her time she was traveling to people's homes to care for sick children. So she does something that really is unheard of now, unless people are willing to pay thousands of dollars for you to come to their home monthly or yearly or whatever, what we call now concierge physicians. She was doing that for pennies. She was probably making a few bucks a day, a month. And she was doing the work that people are making thousands for now per day. So she really did it out of the joy and passion and love of caring for children and caring for family. So I saw that, and that's where I think a lot of my compassion came from. And when I was in college, the decision was, what do I do next with my life? And becoming a physician was a choice that I knew would provide me a lifetime of opportunities to help others, and provide me a lifetime of really important responsibilities, but also a lot of reward. And so that's the path I took.
Do you want to talk about what you're up to as an entrepreneur and really what got you into entrepreneurship?
Before I hit Nella specifically, we're going to see a huge change in healthcare over the next 10, 20, 30 years because technology is starting to converge. The different technologies are starting to converge to such a level that we don't even have an idea of what healthcare could be in 10, 20 years. As Bill Gates would say, we overestimate what we're going to do in a year. We underestimate what we're going to do in a decade. So with Nella, I overestimate that we're going to change people's lives within 1 year. I hope so, but I overestimate it. But I underestimate what we can do in 10 years as the following technologies come and become stronger and stronger. Remote vital sign monitoring, artificial intelligence, sensors, machine learning, all these things are converging so that healthcare is going to look completely different in a decade if we do it correctly. We're asking, well, can we stay open later? Can we have more doctors? What we should be asking is, how can we leverage these technologies so that we need less doctors? We need less brick and mortar space. We need less high cost overhead and more about how do we lower costs and expand coverage to more people by using these technologies. And that's where Nella comes in. So over the past 3 years, when I was a resident at one of Boston's low-income, underserved communities, the hospital's Boston Medical Center, which serves every patient, whether you have thousands of dollars or you just moved from Haiti and you have a penny in your pocket, you'll get taken care of at Boston Medical Center. So we're talking about a very tough population, probably doesn't speak English, and oftentimes is not paying any copays because they're free. Their care is completely free, as it should be, in my opinion, because healthcare is a right, not a privilege. And so when I was working in the ER there, I saw people, 20, 30 patients in a 8 to 12-hour shift, most of whom did not have to be there. They were there for the most basic things, right? They either took few buses to get there or they took ambulance to get there because they don't have any other forms of public transportation. And then they required a taxi or to walk back home because it was 2 or 3 a.m. Incredible inefficiencies in the system. So it was a waste of time for the hospital, and it was poor reimbursement probably. And then it was a waste of time for the patient, complete waste of time for the patient. And that's where we thought of Nella, my co-founder and I, who was a co-resident of mine. We thought of Nella because we said, there's got to be a better way to do this. This can't be what our healthcare system is. This is not what my grandmother believed healthcare should be. This is not what my grandmother believed a doctor should be doing, was providing, subpar care at 2 a.m. for someone who didn't need it and could have easily been done over the phone or in the home, better yet. And then we also saw over the past few years that technologies are growing exponentially. If you have a couple $100 in your pocket, you could have a doctor come to your house within 30 minutes, right? That's amazing. We haven't been able to do that in the past, few years or past few decades. So technology is growing exponentially. And if you have the money for it, you can get great care. You and I can get a doctor on the phone for $50 within a minute, right? But if you don't have $50, you're going to have to take 2 buses, maybe a train, spend 2 hours, sit in the waiting room 2 or 3 hours, not really understand what the doctor's telling you because they don't have an interpreter at the time, be given some paperwork, have to go to the pharmacy by getting there on a bus, et cetera, et cetera. I mean, I hope I'm painting the picture that if you don't have money, healthcare sucks. And so we said, how is this happening that technology is growing so quickly and so well, and people who have money are getting the best technology in healthcare, while those who don't have the money for it are getting the weakest technology, which is just the status quo of how it's been over the last 100 years. That's wrong. That's wrong on so many levels. And the other thing is that there's the business cases there, right? Because the people who are low income, who are underserved, need just as much care, if not more, healthcare. They actually cost a lot to the healthcare system. And so if we can use technology to make a larger impact and keep people from taking those 2-3 buses and wasting their entire night and then not missing work the next day and not getting fired because they had to take care of their child overnight in the ER, we can also save the system a lot of money. So the business case is there and it makes sense. People aren't doing it because it's not sexy, right? It's not sexy to sell a new technology to the low income poor.
Well, I've been involved with healthcare for a little while, but in my little niche, with vision screening. So you painted a great picture of the issue that exists. And I just pictured myself in the shoes of, I'm 55 years old. I make $10 an hour. I have a 4-year-old and an 8-year-old. And I think the 4-year-old might be really sick, but I'm not quite sure. And you painted that picture really well. Like, I can't text my boss and say, hey, I'm not going to show up today at my shift at, McDonald's or something, right?
I hate to say this, but there's a great book called $2 a Day, Living on $2 a Day in America. I think it's called $2 a day. But the idea that people think that in America we don't have people living on $2 a day, that's just a third world problem. That's bullshit. And in that book, it describes beautifully how people, for whatever reason, just luck, right? They get unlucky. They ran out of gas. They can't get to work. They're fired. Which never would happen to any of us in the middle class for the most part. So that is a real issue. And if we don't fix healthcare the right way, that will continue to be an issue for people. So sorry to derail us a little bit, but I just wanted to pass that on. So what we're going to do at Nella is basically we're going to provide any human instant on-demand access to triage, medical triage with a live person any time of day, 24/7. Our long-term vision is to be able to get into people's homes using community health workers. People don't really know what a community health worker is, but it's a workforce that is very well known globally. Community health workers are the first lines, the providers in remote areas. And they do a lot of the initial triage, they do the initial support, and they bump up cases to mid-level providers and physicians if they feel like They are not, they're something a little bit more serious than just the basic medical needs. In the US, community health workers are the hand holders, they're the patient navigators, they're the family's best friend, helping them through difficult times, helping them with resources, helping them understand what they need to do with their doctor, helping make sure that they're taking their medications, and if they're not, what's the barrier to taking medications. And we're learning in healthcare that community health workers we're learning more and more, they're actually incredibly important because us humans, we're not good at taking care of ourselves, and we're not good at navigating the system, especially when we have multiple stressors. So community health workers are becoming basically the doctors and the nurses' best friend to make sure that the patient's actually doing the stuff that the doctors and nurses say they should do, right? We're really good at saying, take these meds twice a day for 7 days. We'd never ask, well, do you have transportation to the pharmacy? Do you have, do you know how to take the medications? Can you even read a prescription label? So
Mm.
that's what health workers are. So we're actually going to send community health workers into the homes of underserved populations, underinsured populations, and we're going to equip them with the doctor bag. So a stethoscope, an otoscope, which is how you look into someone's ear, a stethoscope for heart sounds. These are all technologies that are becoming digital, and there are now new technologies that are allowing vital signs to be done remotely and digitally as well. If you wanted to get an EKG, you don't need to go into the hospital and have a big piece of machinery do the EKG for you, which is a electrocardiogram, looks at the electrical conductivity of the heart. Now you can just open up your phone, download the app, put your thumbs on these special little paddles on the phone, and you'll have an EKG within minutes. This is just the beginning. So we're going to equip the community health workers with this, what we call is the digital doctor bag. So think about the 1900s. Doctor walks around with his little bag. That's all digital. And we're going to give it to the community health workers so they can go into the homes and do medical assessments in addition to all the beautiful things that they do that I just told you, which is basically be the type of person that when we took the Hippocratic Oath, we wanted to be, right? We wanted to be the hand holders. We wanted to be the supporters. We wanted to help people through tough times. That's what community health workers can do. So we're matching this fantastic social model with a low cost-effective medical model. And so we can use community health workers on site and physicians, nurses, and mid-level providers off-site to make better assessments of whether people need to go to the hospital or not, or whether they can stay in their home and receive just some basic medical care and medical advice. If, for instance, Zach, you had a son or a daughter who was 1 year old, I'll call her Jenny. Jenny got sick at 2 a.m. and had a fever. Right now, what you would do with Jenny is you could either call your doctor's office and talk to a nurse. You could go to the ER, or you can say, you know what, I'm going to WebMD it, or I might just wait till tomorrow and hope Jenny makes it through the night. Okay. But if you have no knowledge of what to do, you're probably going to either go to the ER, you're going to call your doctor's office. Calling your doctor's office right now depends on how good your insurance is, but you might get an answer within 10 minutes, or you might get an answer within 2 hours. Most people on Medicaid get an answer within 1-2 hours or never. So they're stuck with trying to decide, do I wait a couple hours when my child is sick and I'm anxious and worried, or do I go to the ER? And so obviously usually the ER is the answer, especially when you want instant gratification, peace of mind. Instead, they can pull up the Nella app, and right now 70 to 80% of Americans have a smartphone no matter what your income is. They can pull up the Nella app. They can go through a few set of questions, assuming they've already registered before time. You've already put in Jenny's info, so we have it all. You go through a few questions after telling the Nella app that Jenny has a fever, and then you get a decision. You get a recommendation. So the Nella app's going to tell you, hey Zach, actually Jenny's fine. Her fever is actually pretty low. She's been doing things that we are quite reassured by based on what you're telling us. We think she can stay home. And then you'll have the opportunity to chat with a live nurse over a text message thread. So any other questions you have, the nurse is going to review the recommendation that Nella gave you and agree or disagree, obviously, ask you a few more questions, make sure that you feel comfortable with that decision. And then we'll go one step further, and we actually schedule an appointment with your pediatrician tomorrow or the next day for you. which is another beautiful thing that people underestimate. So if you are on Medicaid and you don't have a really great primary care office because they're just strapped for time and cash, you're probably sitting on the phone for half an hour trying to schedule an appointment. We'll do it for you. And so you have the peace of mind now, Zach, that tomorrow you have an appointment with your doctor at 2 p.m. and it's okay for Jenny to stay home. You don't have to rush to the ER. You don't have to miss work tomorrow morning. And you don't have to spend 5 hours on a bus and in the ER just wasting your time. The last thing that we do at Nella is actually we connect you with a community health worker over the phone as well. So let's say we said, hey, Zach, Jenny actually just needs her albuterol a few times overnight. Albuterol is a medicine that is commonly used for asthma. If you say, hey, I ran out of albuterol for Jenny, but I don't know how to get any more medicine and I don't have a way to get to the pharmacy, that's actually something we see in the ER. So we oftentimes see people who come to the ER and say, I just ran out of this medication and my doctor hasn't given me a new prescription. That's $1,000 cost right there to the system. So what we'll do is actually this community health worker will get on the phone with them and say, oh, okay, that seems like a major issue. I'm going to help you figure that out. And so we go to every possible end to make sure you don't use the ER. And we'll actually help you get to the pharmacy and get the prescription. Or potentially we'll even deliver it ourselves with the community health worker.
It's incredible. So you're a part of the Harvard incubator?
Yeah, last February we were accepted to the venture incubation program as just an idea. And so over the spring of 2017, we continued to formulate the idea, narrow it down a little bit more. Over the summer, we brought on a engineer designer to help us design the platform for Nella. And currently we are getting close to pilot testing. So we found a small amount of parents who are excited to test out with us our full-time real live product where we'll offer a live nurse, instant access, instant decision-making, and support. And we're hoping to go live with the pilot early 2018.
Awesome. So when do you sleep?
That's a good question. Well, let me tell you this. I sometimes sleep more and cut out other things in life.
There you go. It's all about prioritization, right?
That's exactly right. I actually slept in a couple of late hours. I was going to get up at 6:30 today and slept until 9, which is, hard. Too much snoozing. But
Yeah.
when I was in residency, I was actually unhappy. I have to say. And I always am happy to talk to people who are aspiring to be physicians or medical students because medicine isn't really so glamorous. The idea of Grey's Anatomy and Scrubs, I think sometimes paints a false idea of what medicine really is today. Um, it's becoming a very impersonal profession where a lot of time is spent behind a computer. I'm sure this is not something new to what you've heard or any of the listeners here of hearing, and they can relate to it. And in residency, I felt very unfulfilled in what I was doing. It had become much more of a business, and I was a cog in that business, a cog in the wheel, rather than a person who really was changing people's lives and helping people get through their lives in a healthy, well-being way. And that's where Nella really helped me because now I am fighting for something that's going to improve people's lives and give them the opportunity to be healthy and get to work, make money, and improve their family, improve the circumstances of their family. And that's what keeps me going. And I don't mind a lack of sleep or a lack of time to do other things when I feel like I'm really making an impact one day. Whereas as a physician in the system in residency, I wasn't feeling that way. When a person took 2 buses to see me and all I had was 15 minutes to give them, it really is tough. It's really tough. And you just get angry. You get angry because you can't believe that the profession that you really care about has become so fragmented that you're not doing what you really want to do, which is improve people's lives. Instead of what you're doing, sometimes it feels like you're just going through the motions while the patients suffer. And so I'll tell you, I'm a much happier person now where when I'm able to put a lot of time into Nella, because I do believe it's going to allow me to do what I went into this profession to do. And it's going to I'm gonna do something right by my grandmother, and that's why the name Nella comes from. It's what it comes from is my grandmother. That was my grandmother's name, and we decided to name the company that because we really wanted to build it in her values and ideals and what to kind of project the vision of what medicine should be.
Love it. So what is the revenue model? Is it going to be a nonprofit or is it a for-profit?
For profit. And I'll tell you why. We don't want the poor to feel like one year they're going to get great services because they got a grant for the services. And then the next year that grant's dried up and those services are gone. We want to be a sustainable revenue model so that now and in 10 and 20 years, our services are just getting better and better. And the underserved are getting better services than the people who have the means to do so. So our for-profit model is this, and it's all based on how healthcare is changing over the past 10 years. It's going away from a fee-for-service model and going more to a value-based care model. I assume you know this, and most of your audience may know this, but instead of a hospital getting paid $1,000 for when you show up to the ER, no matter if you do it today, tomorrow, and the next day, they get paid $1,000 for that visit. To now, they're saying that hospital's getting a certain flat fee for your healthcare throughout the year. And if you show up to the ER today, tomorrow, and the next day, that actually comes out of their bottom line. So it's in now all of our best interests to make sure that people get excellent care and are healthy and staying out of the hospital, rather than more usage equals more money. And so now that our incentive system has gone from being very, very perverse to how healthcare used to be, to a very, very logical, right? Why would you get paid for care that made you come back to the hospital the next day? There's a huge incentive to keep people out of the ER when they don't need to be. And you see that as insurance companies start making deals with people that if they use the ER inappropriately, the person pays out of their own pocket. I don't know if you've seen that in the news recently. But so what Nella does is it keeps people out of the ER if they don't need to, if their needs are not emergent needs, and they can use the primary care office. And so there's money to be saved there, and that cost savings will come back to us and allow us to create better services.
It sounds like you don't have a lot of time for hobbies, but I always want to ask this question. What are your hobbies? Do you have any? No, it can be a hobby. That's fine. It's a passion. Like I'm the same way. I don't really do much outside of, the only thing I really do outside of work and our mission and my wife and dogs is weightlifting. Like that's all I've got. So Do you have anything?
You know what? I always tell myself that I don't want to end up like my father. He has no hobbies and and don't want to be that. So I've tried to pick up a few, which includes sailing, running. I'm kind of thinking about doing improv and seeing how that goes. But it's always hard. It's always hard. One thing I've been doing now, and I actually tore my ACL back in June. I tore my ACL the day before I was graduating from residency. I tore my ACL and my meniscus, and it changed my life a little bit. Is a hobby now for me is having a very healthy diet and reteaching myself how to eat and reteaching my taste buds what healthy is and what unhealthy is. And that's a really interesting process that I like to share with people. And then also meditation and mindfulness is a hobby of mine now. So I recently read the book, The Power of Habit, which basically says that we can do anything as humans if we create the habit behind it. And
Yeah, great book.
What I do now every morning is I meditate. The first thing I do in the morning is meditate. I don't know about you, but what I used to do is I would wake up and I would start looking at my emails and I would start looking at my text messages, and maybe I might even get on social media, which is such a crazy way to start a day. I always tell people that, like, how do you start your day? If you start your day by checking your emails, that can't be right. That can't be good for your brain. So I'm getting more and more into meditation and mindfulness because I believe that's a really important hobby, one. And it also, I think it allows me to be more impactful and better with relationships that I have in life.
Absolutely agree. So that leads right to my next question. You've already mentioned 2 books. You mentioned you think it might be called Living on $2 a Day. I'll put it in the notes. I'll find out the exact title there. And then you mentioned Power of Habit, which is a great book. What's a book that you would recommend for your peer audience, your pediatrician audience? Maybe let's think about all the pediatricians that are hopefully going to be listening to this soon. And what if they want to impact healthcare in their own way, whether that be through technology, but it's most likely through general entrepreneurship?
The one that pops into my head is called Bold, B-O-L-D, Bold, by Peter Diamandis. That book, I think, was the first entry point for me to understand how rapidly our world is innovating from a technology standpoint, and how far behind I was and the healthcare industry is in thinking about it. And that's one. And then two, that book also helps you understand, do you want to be a change maker? Do you want to be an innovator in the healthcare world? Are you right for that role? And if you are, how do you go about it? And so that book, I think, gave me the motivation and the helped me understand what my passion really is to make a difference in this system. So I highly recommend it for anyone who is thinking about technology, thinking about innovation, thinking about how do companies and people in this world make such large scale and changes. And what Peter Diamandis really pushes people to think about is, how do you make a 10x difference rather than a 2x difference? 2x being, instead of helping 10 people within this time frame, you're helping 20 people, right? But with technologies that are converging right now in our world, we should be thinking, how do we help 100 people instead of those 10 people? There are billions of people in this world who don't have internet access, but will have internet access maybe within the next 10 years. What does that mean? What does that mean? And so as pediatricians, we have this amazing ability to not only treat humans with the science and the knowledge that we have, but we also have this beautiful compassion in us that we really want to care about the well-being of people. That's really what pediatricians are. They're always thinking about well-being. And so we have to make sure that we are also the ones that are part of the conversation within the innovation world, because we have to bring that compassion in there. And so I think that book, Bold, does a great job of getting people to get on the same level when it comes to innovating as the for-profit companies, as the business people in the world who are excited to make money and make a difference, but may not bring the same compassion and drive to help people with their well-being as pediatricians do. So I'd really recommend that book.
If people don't get inspired by Nella, then I don't know what to tell them.
Thanks for listening to my rambles for an hour and a half or however long. Hope it was helpful.